So when I was asked for the Actrum's presentation, and it was a pleasure to give the Kenneth Johnson lecture. And as I mentioned to the audience, Ken was my attending neurologist when I started my training. That when one looks back on neuroimmune interactions, the classic way the field started went back about 130 years to Pasteur, where the injection of material outside of the brain, which was neural tissue containing material, as it happened had inactivated rabies virus, resulted in inflammation and some demyelination in the central nervous system. And that led to an animal model called experimental encephalomyelitis or autoimmune encephalomyelitis, EAE. And that set the precedent that a disease activated outside the brain could induce inflammation inside the brain. And was this the same as multiple sclerosis? And I think what we have learned along the way is the course of multiple sclerosis has been rather different in that with that initial model, and even in the humans that were immunized back in the days with neural tissue, most of the events were a one-time uniphasic inflammatory disease, rather than what multiple sclerosis has shown, if untreated, will go on to be a relapsing disease, often with a progressive component. And so we have, and people actually after a relapse have some degree of recovery. So I think what we've learned or have to learn is that something else is contributing to driving the course of the disease. And in addition, we've learned that if you wipe out the systemic immune system in people with established MS, and it's already ongoing, that you will not arrest the disease and you can still get the progression. So I think that what we've been learning is that what occurs when the immune system from outside the brain gets into the brain or the central nervous system, what is that interaction? What's driving the process? And so we're trying to learn about immune-brain interactions, if you will, and it's bi-directional. Immune system's acting on the brain. Brain cells can talk to the immune system, and many of the brain cells, the glial cells, they themselves can interact with the targets of MS, which are the myelinating cells and the axons. And I think the other issue that has come up from the study of the neuroimmune interactions is most of us have always thought in terms of injury and disease. Why do we get this animal disease, EAE? Why do we get MS? The other side is that whether the immune system and the components of the brain can contribute to injury and repair. So neuroimmune interactions is two-faced. One is the injury side that we can learn about. The other is, can we harness it or modulate it to be protective or contribute to repair?